Welcome to Pennsylvania in Focus. I'm Kristen Smith. Joining me today is the Center Square's Pennsylvania reporter, Christina Lingell. Christina, how are you doing today?
Good, thanks. How are you?
I'm doing well. And earlier this week, you reported on a hearing about some of the consequences that Pennsylvania could face should expanded subsidies for the health insurance marketplace expire at the end of this year. For context, these are subsidies that were expanded in 2021 during the pandemic, and they were meant to help more middle income families afford insurance on the federal and state marketplace, as it were. These are people who don't qualify for Medicaid and who can't get insurance through their employer. But there is a huge concern that should these subsidies go away, that these people and many others are going to be facing a very big crisis situation. So tell us more about what you heard at this hearing.
Yeah, I was actually very, very surprised watching this hearing that so much has changed since these subsidies went into effect, or that rather that they've made such a big difference that if they were to go away, it could have really detrimental effects on the entire healthcare system across the state. And part of that, of course, is because we have seen so much just through attrition, through demographic change. Like, we have seen our healthcare labor force really shrink. And currently we're already not well able to meet the demand. So when we start talking about changing insurance coverage, when we talk about people losing insurance coverage, then we're talking about an increase in uncompensated care. And when we have uncompensated care, we have hospitals who have to make difficult choices and ultimately oftentimes close their doors because they simply can't afford to run on a negative profit margin. And so when we say, oh, well, some people might lose their insurance, then that means that hospitals are going to lose income. And when hospitals lose income, they lose staff and they ultimately close, which means there's less healthcare accessible, even if you do have good insurance. So a lot of people might hear about this problem and think, well, these are people on Medicaid, or these are people who have gotten their insurance through Pennie, the state's insurance marketplace, through the ACA. But unfortunately, that's not the way that our ecosystem works. Everything is connected. And so when we have losses in one area, it impacts everything.
Right. There's 24.3 million Americans now who use the insurance marketplace. In Pennsylvania, there's 500,000, and those numbers have risen significantly over the last 4 years. So nationwide, 24.3 million is more than double what there was pre-2021. In Pennsylvania, we've gone up by half. So it's a significant number of people that are going to be in a difficult spot. And for reference, the middle income threshold that we're talking about here is $104,000 a year for a family of three. So that's still a relatively modest income in today's economy. And these are people who are small business owners and are other walks of life. It's not people that aren't working, that are fitting the stereotype of people who some may worry are defrauding the system. Pennsylvania has worked really hard to combat that. But at the same time, it's a catch-22, because I think at the congressional level, you look at the cost of extending the subsidies for the next 10 years and you're $335 billion. And when we're in an age where we're really trying very hard to reduce the size and scope of government, that's a big price tag for people to swallow. But like you said, it's all connected, right? So if we lose, estimates from the Congressional Budget Office are saying, if we lose, we get rid of these subsidies, there's going to be at least 3.8 million more Americans who lose insurance. And the thing is that a lot of these people are healthy, and healthy people keep the cost of insurance down. Mm-hmm. So you're in a really, like I said, you're in a really difficult spot here, because not only are healthy people going to lose insurance, but then the people who really need to stay on the insurance, it's going to become even more affordable. So it's just like this cascading effect, right?
Yeah. And even among healthy people, when people put off routine care and preventative care, they can easily go from being healthy people to unhealthy people. So you might have someone my age who is like, you know what? My job doesn't cover me. If I can't afford the new premiums on Pennie, like I'll be okay without insurance. But let's say that means that I'm not getting routine screenings and perhaps then a cancer that could have been caught earlier would appear. That's something that we saw it a lot during COVID because people were avoiding going to the doctor because we were avoiding going everywhere, right? Like unless you absolutely needed to go to the doctor, you weren't going to the doctor. And so now to this day, we have people who are still recovering from diseases that basically would have been better managed if they had been able to go to the doctor then. So we'll see that happening with uninsured people, regardless of whether or not there's a pandemic going on. When they put off care, then they don't show up to the doctor until it's an emergency. And when it's an emergency, it can be too late, or it can create circumstances where they're essentially an even larger, I don't want to call people financial burdens, but it's an even larger cost to the state when someone is disabled by a medical event and then can no longer work and then has to receive additional benefits. So when we look at the economic impact, it's not just how much are we spending on insurance subsidies right now. It's how much will we spend if we don't have the care available for people. And I think we've seen COVID has given a pretty good idea of what it looks like when our healthcare system becomes really overwhelmed. And especially in rural Pennsylvania, where they said actually premiums could double. I'm not exactly sure how it works out that your geographic location impacts your premium, but the director of Pennie did flat out say that for rural people, it's more likely to double. They already lack access to care. They have to drive further to get to care and often put off care because it is such a significant time taken out of their day to get to a doctor, to see a specialist. So if we see more hospitals closing their doors, I believe Secretary of the Department of Human Services, Val Arkush, she said that I think half of rural hospitals are already operating on a negative profit margin. So they don't have really any room to lose money here, and losing insurance coverage will lose them money. They won't be compensated for care.
I think nationally, federal data points to the fact that if these subsidies shrink back to their pre-2021 levels, you're going to see the average premium go from roughly $750 to over $1,500. So that's, what is that? A second mortgage for people? Maybe even more than that. And so it's not that people aren't, I think it helps to contextualize it in dollars, because for those who are on employer sponsored healthcare, for example, our premiums are far lower, maybe a couple $100 a month. And you talked about the issue of rising care and how healthy people can go to unhealthy people very fast. I think we all are familiar with medical debt and how that impacts everyone, whether insured or uninsured. And to see a rise in medical debt, that's already going to make an economic situation that is difficult for a lot of people right now. That is going to make it worse. So there is there is a very serious consequence, it seems, for letting these subsidies lapse. Now, to be fair, we don't know one way or the other what's going to happen. There's speculation out there. There's people far smarter than I who analyze these things, who believe that it's highly possible that Congress will choose to extend these subsidies another year or two, even though there's a lot of advocates now who are saying we need to do it permanently. They're really trying to get out ahead of this issue, right? Because January, as far as Congress goes, might as well be 10 years away at this point. And so it's not really a huge part of the discussion yet, but it's coming, right? So where Pennsylvania has to get really specific, though, is that our demographics are especially challenging for this situation, right?
Yes. So we are an aging population and a rapidly aging population. So right now, about a quarter of Pennsylvanians are over the age of 65, and that will soon be a third. I think people over the age of 80 are, one of the fastest growing segments, even within that. A lot of these people are living in skilled nursing facilities or receiving in-home care. And among those nursing facilities, they are on average operating at a negative 5.5% profit margin. So they are already providing a great deal of care that they can't actually afford to provide. So basically we have a lot of aging people with a lot of medical needs, and that group is only growing, and that cost is only going to grow. And most of them are using Medicare. And for most of the people who are using Medicare and Medicaid, these are payers of last resort. If they have other insurance, they use that first.
Well, we'll certainly be keeping up with this story as it develops. December will be here before we know it. So to keep up with us at thecentersquare.com/Pennsylvania, and I'll see you next time.